Is a 50% blockage dangerous, or is it manageable with lifestyle changes? Friends, let's talk about this important topic today. Now, your cardiologist has told you that you have a 50% blockage in your heart. Does that mean you're halfway to a heart attack? Or should you be rushing to get a stent? Or can you actually treat it with medications or even reverse it? And the bigger question, can a 50% blockage sometimes be more dangerous than a 90% blockage? Let's break this down so you know exactly what it means for you and your heart in the future. So friends, what does a 50% blockage mean first of all? So a 50% blockage means that your heart artery is narrowed by half compared to normal. We usually measure this during an angiogram or with intravascular imaging or even during a CAT scan like a coronary CTA. Now, when there is a 50% blockage, the blood can still flow well enough in most cases at rest. However, it depends where the 50% blockage is to decide whether or not we can treat it just with medications or we need to do stent or surgery. So friends, if the 50% blockage is in the left main artery of your heart, then that is a significant blockage because that artery is the main artery that divides into the circumflex and the LAD. So even a 50% blockage is severe enough for us to recommend stent or surgery, and mostly surgery in this case. However, if a 50% blockage is in an artery other than the left main, then depending on symptoms or presentation, meaning if you've had a heart attack or not, and if you're having severe symptoms or not, we may need to do additional investigation. And those additional investigations are usually in the form of intravascular imaging like IVUS or OCT. So friends, why do we do this imaging? We do this imaging to see if there is an unstable plaque, if there is a plaque in the artery that has ruptured, or it is soft plaque which shows that the fibrous cap has been removed from the top of the plaque. And the reason we worry about this plaque is because of it being unstable. It can rupture and cause a heart attack, even if it is a 50% blockage. So friends, in other blood vessels, whether or not we need to do something about the 50% blockage really depends on if that is an unstable 50% or a stable 50%. Now, if the 50% block is in a small artery or a small branch of the main vessels, or if your symptoms are not significant, then 50% blockage in most cases can just be treated with medications and lifestyle changes, because the goal here is to prevent the progression of 50% blockage. Because for most part, a 50% blockage is not severe enough to cause symptoms, but it can become worse in the future and become significant and cause symptoms or heart attacks. As we discussed, the real danger is not just the percentage of narrowing, but also the type of plaque. So that's where the intravascular imaging is useful. Now, let's talk about what can we do about the 50% plaque. Number one is lifestyle change, because a 50% blockage, as I said, usually will allow enough blood flow to go to the rest of the heart. Now, it is a strong warning sign that you need to make strong lifestyle changes so it doesn't get worse. And in many cases, you can manage a 50% blockage without stent or surgery. So, the lifestyle changes include heart-healthy diet, like the Mediterranean diet, plant-based diet. It is very important to limit or completely remove red meat from your diet, because the red meat causes a lot of inflammation in the body. And the issue with inflammation is that the inflammation is the reason why even a 50% blockage can rupture and cause a heart attack. So that's why maintaining low levels of inflammation in the body is very important. And plant-based diet does not cause inflammation like animal-based diet. The other reason is doing regular physical activity, because this promotes better circulation in your body and also your blood vessels of the heart and gives you a better cardiac conditioning. The other third is managing your stress through meditation and breathing, because these interventions reduce your blood pressure, reduce your heart rate, and they again minimize the chance that a 50% blockage will rupture or cause issues. Of course, friends, as a next step, definitely you should stop smoking completely, because it's a known reason why plaques rupture and get worse. And lastly, you should keep a blood pressure check, your cholesterol should be checked, and your blood sugars under control. One important point about statin medications. Even if your cholesterol, the bad cholesterol, LDL, is on the lower side, then people tell me all the time, doctor, why do we have to take a statin medication? My cholesterol is low. But that's because if you have a 50% blockage, the statin medication makes the plaque more stable and less likely to rupture and less likely to cause a heart attack. So if you have a 50% blockage, the mainstays of your therapy are going to be these lifestyle changes that we just mentioned, and also the aspirin, baby aspirin, 81 milligram, and a statin medication. So friends, in conclusion, 50% blockage isn't a sentence, it is a signal. With the right changes, the right medical guidance, and good exercise conditioning, many people live a full, active life without ever needing a stent or a bypass surgery. So friends, I hope this helped you to understand your heart better. And if it did, please hit like, subscribe, and share it with anyone who might need reassurance today. Thank you.